Hey guys, welcome to my channel, The Ready Nurse Nay. Today's video, we're going to be talking about what to expect your last semester of nursing school, of your program. So, if you don't know, I graduate in 2 weeks. And I might have graduated by the time this video is posted. But anyway, this is my last semester of nursing school. I'm in a BSN program, and I'm kind of going to be telling you like what to expect. So, what to expect is going to differ depending on if you're in an ADN program or a BSN program, depending on if you're an accelerated program or traditional program. It's going to differ as far as how your last semester looks. But for me, I'm a traditional student obtaining my BSN in nursing school, and I keep saying that, but my bachelor's of science in nursing. And this is kind of how it looked for me. If you are a new student or you're wondering how your last semester, how to plan out your last semester, what to expect, this is kind of how my school worked for the last semester traditional BSN program. So basically, we had class 1 day a week, and for us, we had a transition into practice class, and then we also had a class where we basically went over everything we learned to kind of prep for the NCLEX, and that was on 1 day a week, which was Wednesday for us. And then we had a few assignments mixed in between throughout the semester to turn in, and then we also had our practicum, which is basically 6 weeks of picking the specialty that you're interested in, and you're working with that nurse and you're actually doing that job for 6 weeks. So that's kind of what the schooling part looked like for us. You're not learning anything new. You've learned all your stuff. You're really just preparing, putting that stuff into practice in the hospital, or whatever you pick to choose as your practicum experience. So I picked the OR, so I was in the OR for 6 weeks. And then I had class, for Wednesday for this semester. So that's that part. I'm trying to see other parts in this semester. Your last semester, you can start applying for jobs. It's not too early, to be honest. You're in your last semester. The hospitals are recruiting. They're looking for you. They want you to come work there. They want you to make a commitment to them. So there's recruiting events going on throughout the especially that last semester that different hospitals put on. So you have their look. It's not too early. It's not too early or too late to apply for nursing jobs. So your last semester, this is where you can start applying for jobs that you're interested in. You can start working on your resume. If you don't have a resume, I would say get with your school's career center if they have one, or even like your teacher, or maybe if you have family members or something like that are decent with resumes to help you prepare your resume, because this semester, your last semester, you're going to start applying for jobs, which is exciting. And as part of those jobs, those recruiting events I was telling you about, sometimes you find out about them through your school or even through like the hospitals. You're able to sign up and just get like updates if they have that with the hospitals, or I would do that because you'll find out about recruiting events where that the hospitals or clinics are putting on to try to get new grads to come and learn about their facility. So I went to two recruiting events this term. One, and they were each by different hospitals, and one was at like a restaurant, and they had hors d'oeuvres and like drinks and stuff for us to eat, and I went with one of my nursing friends, and that was really nice and fun. You meet, and it definitely is an end, okay, because you meet like the manager of the departments, so that if you know that you're a new grad and you want to work in specific specialties, you want to work in the ICU, you want to work in the OR, you want to work in the ER, you want to work in peds, you're meeting the managers at these recruiting events. So you kind of get the end. They put a face to your name. It makes it easier to get your application where you want to get it and to work in the places that you want to work at. So I recommend going to them, and they're fun. You get to network, you get to recruit, you meet people, you add them on Facebook and LinkedIn or whatever. And you have a contact at the hospital. I went to another one. It was at a restaurant, and it was nice. The food was good. They rented out the whole balcony part of the restaurant. There was a ton of food, and they had it set up so nice where each table had a manager of all the different departments at their hospital. So like you can go in there and sit at the table and talk with those managers of that department that you were interested in, and just learn about them, hear about their stories. You get their information, like their contact information, to reach out to them. And so I would recommend that, recruiting events. You know, like I said earlier, you're doing your resume, any letters of recommendation, you're getting those. You can get those from your teachers, even like peer letters of recommendation, teachers, or even if you meet somebody on the unit that you're precepting on, you can get letters of recommendation from them as well. You're applying for jobs, and then you're also doing like your licensure paperwork. Normally the school does this with you. If they don't, you know, you can Google, or they probably will help you some type of way, but you're doing your pre-licensure paperwork for your NCLEX prep. Other fun things going on in your last semester, you're taking your grad pictures, you're ordering your invitations. What are some other things? And then even like, you know, that's all the fun stuff, preparing for that. And then other stuff to kind of look into, I think student loans, you typically pay those back within, I think, 3 to 6 months after graduation. So these are all things that are what to expect your last semester of nursing school, kind of like preparing you for transitioning into the world of nursing from student to nurse, but also transitioning you through your last semester of finishing out your program. So hopefully that was insightful and gave you some information. And if not, you know, like, comment, subscribe, and I'll see y'all in the next video. Bye.